I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have a really exciting guest today. I have Brad Turner, who is the Commissioner for the Department of Disabilities and Aging in Tennessee. Welcome, Brad.
Hi, thank you for having me. Really excited to be here and looking forward to a good discussion.
So, Brad, I just want to get started right off the bat with tell us first, how did you get into the field of supports and services for people with intellectual and developmental disabilities?
Yeah, so it's actually very personal to me. So my daughter, Kinsley, has cerebral palsy and has significant intellectual and developmental disabilities. So really on a personal level, that started about 19 years ago in 2006. But more on a professional level, I was asked to be the commissioner by our current governor, Bill Lee, in January of 2019. So I've been in this role a little bit over 7 years. But truthfully, it started much longer than that as a dad and as an advocate and trying to better understand what the disability space looks like. So I try to bring that to the table, but really blessed to be Kinsley's dad and very blessed to be the commissioner for the state of Tennessee as well.
So how does that shape your perspective, having someone in your family with an intellectual disability?
Mm-hmm. Well, I mean, it's one of those things that, I think whether it's strategic discussion, whether it's engagement with advocacy groups, whether it's conversations with the governor's office and the legislature, sitting in the seat real time every day at every hour changes how I do things. And so I have told folks this a lot, that there's nothing about my job that I can fake. That when I tell people I understand what you're going through, there's a level of sincerity and truth there that I understand that. And I mean, truthfully and very transparently, a couple of weeks ago, we were dealing with a medicine shortage for my daughter's epilepsy. So I basically took most of the day off just to try to call pharmacies all over the state of Tennessee to try to find one bottle. So having that lived experience, I think, as a parent, allows me to sit in the seat much more comfortably, but also much more with an awareness about what's really happening compared to what you read on the headlines. It allows me to really dive in and say, I know this is impacting families. So everything we do here, I ask two very simple questions. Is it the right thing to do, number one? And number two, will it help Kinsley, who is my daughter, and her friends? And if the answer is yes to both of those things, then we dive in with both feet. And that's exactly what we've done in Tennessee.
That personal perspective certainly, is extremely valuable. I'm certain in the work that you do, and it's not something that everybody can share. And I like the questions that you ask. In medicine and practicing medicine, one of the things I learned early on was, the person that you're responsible for is the person sitting across from you, the patient in the room with you. And that is how you should make all your decisions, not based on the insurance companies or whatever all of the rules and regs are. I mean, of course, you've got to follow them, but you really need to do best for that person. And with you having that personal perspective, that really probably makes it a little bit easier to see it from that perspective, for sure.
Yeah, I mean, there's always going to be some universal challenges that I think anyone in the disability community runs into, but having that firsthand experience and that real-time perspective, I think has allowed us to do some things that have been really innovative, but also, to your point, sticks to the core of what we're trying to do, and that's trying to create independence for people all across the state of Tennessee to pursue the American dream for themselves, which, as you know, just in the IDD space, that has been something that has been so far over the hills where they can just see it, but they can't get there. What we're trying to do in Tennessee is how do we start creating an environment for people to chase that American dream? And I think we've done a really good job of doing that so far.
Yeah, well, that's a perfect lead into what I was going to ask you next. So what are some of the initiatives? What are some of the things happening in Tennessee to move that forward?
Yeah, there's a lot of them. So one of the things that we started talking about when I came in 2019 was how do we really build this lifelong service continuum? And it's not, I think one of the things that's been really tricky is you hear a lot of folks talk about, well, they have to have this, they have to have this, they have to have this. What we've done is really tried to create a service delivery system where we're there when they need us. And then we're kind of the interstate where they can drive along. And if they need an off ramp, we're there. If they need to go past that off ramp and get off of the next one, we're there. And so it's really creating a system of support where at every step of the way that if they need some supports, we're there. But we encourage them to know and be confident in accepting the fact that it's okay if you don't need this right now. You can do it on your own. You can do it with the help of someone that's in your community or your natural support system. So we've really tried to do that. A good example of that is we're the only state in the country who has the early intervention system extended to the age of 5, which means that any child that comes into our system with developmental delays can stay in that system until they're age 5, which then they move into kindergarten in the public school system network of support. That was really important to us because we found out that parents were getting uncomfortable with, they stop at 3, they lose some of those milestones and markers that they were meeting. They regress a little bit. Then when they get back in school, the children have to then play catch up, and that was delaying their learning and all those things. That was one of the things that we did really early on that started seeing some significant difference. And one of the things we're most excited about is the first cohort of those individuals that were children coming in at age 3 are now moving into kindergarten at age 5. And we have been celebrating that this year with intentionality to say, hey, your child can do this and this program does work. So that's just one example. Another example that we have is a program called MAPS, Medicaid Alternative Pathways. And it's a Medicaid diversion program, which allows individuals who are exiting high school and moving into adulthood to actually utilize technology to be able to learn to be independent, to be able to understand how to better live in the community, understand their transportation needs, understand how they can train for jobs or employment utilizing technology. That has created an environment for us as well, where those individuals do not have to just jump on the state Medicaid waiver just because they turned 18. It's allowed us to create a system for them that promotes independence, that challenges them to be independent. But again, as they're going down the interstate, if they need to get off at an exit ramp, we're there to help them. But so far, we've seen a lot of individuals, almost 1,000 in our state so far that participate in that program, that are more independent than ever. And that would not have happened if we didn't have a governor and administration and state legislature that challenges to be innovative, to really drive solutions, to your point, Doctor, about the person across from us, instead of making sure that we're just doing what the program historically had done. We're both doing what the program has historically done, but we're also making sure that we challenge ourselves to be innovative. And we're doing a really good job of that. And I've got a great team that is all full of people that are a lot smarter than me that have made these programs work.
Well, that really does sound like some very important projects. And when we think about, people having the choice, say, to utilize services when they need them, and that's really what we're all, we all want for our own lives. And that's what I always try to stress is like people with IDD are people with the same likes, wants, desires, and needs as everyone else. And none of us really like to be told, you've got to do this, this, and this. We want the opportunity to choose, okay, right now I might need this. Oh, but later I have the opportunity for this. So that makes a lot of sense for sure.
If you think about it, we're the only portion of the protected class in the country of 9 of them where people are still actively discriminated against, where people actually endorse that discrimination, whether it's inside the classroom with segregated learning, whether it's with institutions and states that might still have them. It's still active segregation that people not only embrace, but actually encourage. So we've made a lot of really good progress around the person-centered approach, but we still have a long ways to go. And I'm glad that Tennessee is leading the way, because we want to continue to push the country forward in that direction where we're thinking about the person being told yes instead of being told no their entire life. And if you think about just the damage and the challenge that does to somebody, I can speak to it for myself. Imagine being, living your entire life and all you're ever told is no, and you can't do that. It becomes very damaging to your mental health, your emotional health, your spiritual health, all of those things. But our community and those who find themselves disabled have been told that their entire life. We just have to continue to keep breaking that mold and making sure that we're saying yes more than ever, so they actually get to pursue the American dream that I was referencing earlier.
Man, I love that excitement and passion and perspective that you have. And it's infectious. And I hope for everyone that listens, including all other state directors, listen out there. The other thing you mentioned, I just wanted to touch on was you mentioned the early intervention aspect and how you continue it. And we know that early intervention makes a difference in many different areas, including the ability to function and to gain skills and to recognize, from my perspective, from a health perspective, we want to catch things early,
Sure.
so that we prevent more negative outcomes because we waited too late. And the same thing kind of applies to that as well too. So it's great that you guys have extended that opportunity for early intervention for sure. Yeah.
Yeah, I was going to add just one thing to that. It's you really touched on what we're trying to do, and that's really that early identification that some milestones might not be met. And the other thing that we do, and I think this is a big portion of not only our discussion today on your podcast, but holistically across the country, is making sure that people understand the best thing that you can do is get supports for your child. It's very scary. A lot of parents, myself included, have been in that position where you hear from doctors and from healthcare professionals, something isn't right here and there's milestones that are not being met. That gets really scary to the point where sometimes the avoidance then delays what could be a really positive experience for your child. And so we also try to build into that the family network, the natural supports for the child, to make sure that they understand, hey, you can help here. And we promise you that it's going to be the best thing for your child. And so it's not just making sure that we meet the needs of the child, but that we actually encourage parents and the family members of that child. It's okay to get some help. It's okay to say, hey, there might be something here. We don't ever ostracize. We don't ever scold. We don't ever, slap the wrist of people that don't do it. But early intervention is just that. It's early intervention. We try to get to these children as early as we can, so the outcomes will hopefully be more favorable for them because we found it at the right time. So we have dropped the actual age of referral in our system. When we started, it used to be close to 18 to 22 months. It's now under 16 months, closer to 14 months. So the more children that we're getting to, the quicker that we're getting to them, we're seeing much more positive outcomes. And I think that's the thing that I want to always encourage parents is the sooner we can get in there to help your child, the better they're going to be when they get into school. And hopefully early intervention will be something that you can celebrate participating in and recognizing that it created a strong foundation for your child.
And from a medical perspective, all of that makes perfect sense as well too. So it's totally supported that way. And one thing I'm going to add, I talk a lot about the need to educate clinicians, healthcare providers to be able to understand how to provide good healthcare for people with IDD, and understand that we shouldn't say no all of the time, or this isn't good and this isn't going to work. And it reminds me of a previous episode where I talked with the former state director about their grandchild, and even the clinicians were saying, well, he'll never be able to do this. He'll never be able to do that. And if we accept those things, then they may never be able to do those things. But if we come with the attitude of they will be able to do this, it may take a little extra intervention, a little earlier intervention, and they will be able to do things that can really change a person's trajectory for life. And I think as healthcare providers, as supporters, we need to always be thinking in that way. They will be able to do these things. They can do these things. They may just need a little extra support, just like some of us do in some areas of our lives, right?
Right. And that's the thing. I mean, your words have power and they have influence, and they really have power and influence over a child. And so I think sometimes we forget that children are listening and they hear what's being said about them, both to them and about them. And that's one of the things that we have worked on very deliberately and very directly with healthcare professionals in our state. We work very closely with the American Academy of Pediatrics, who you're familiar with AAP. We work very closely with the Children's Hospital Associations. We work closely with the hospital associations as a whole, so they understand the power of early intervention and that they're actively referring folks to that. That's one of the beautiful things in our state is anybody can make a referral for early intervention. It doesn't have to be a parent. It doesn't have to be a family member. Anyone can make a referral, and the system is built that way on purpose, because one of the things that we have seen is the number of referrals that we receive after Thanksgiving and Christmas are always our biggest times of referrals, because parents and family members are around. Yep. And sometimes it helps to have somebody that's not eyes on the child all the time to say, hey, I think there might be something here we need to look at. So we always take those referrals seriously. But parents trust their doctor. They trust their pastor. They trust people in their community who they believe to be trustworthy and know what they're talking about. And so the doctors and the healthcare professionals are ones that we really key in on, because the parents are going to listen to what you're saying about their child. So both good and bad. But we really want folks to know that, hey, you can really help this system thrive by sharing with families about it, to make sure that they know that that program, just because they're in the early intervention program, does not mean that that's a lifetime of diagnosis of a disability. I think as parents, sometimes we go to the worst case scenario, that if this happens, then this means this is going to happen, this is going to happen, this is going to happen. Then you get overwhelmed with negativity and stress about what could be instead of what is. So we really challenge and encourage healthcare professionals in our state to make sure that you view TEIS in a very positive and productive light. And when you share information about our program, make sure that you share it with that sort of enthusiasm with the parents, because they're going to listen to you and believe what you're saying about the program.
So I'm guessing TEIS is Tennessee Early Intervention Services.
That's, you know what? You are much smarter than they told me you were. So that was very good. Yes, that's it. TEIS.
I try. Every once in a while I get lucky.
You did great.
So what's next for Tennessee? What do you see, in the pipeline as far as services for people with IDD?
Yeah, I mean, we're always going to continue to drive independence and innovation. I think we're actually in the process. We're getting 3 new buildings right now in the state of Tennessee that's specifically geared towards disability and aging services. And again, Governor Bill Lee has been an absolute huge proponent of supporting us. We've seen an increase of $500 to $600 million in funding over the last 6 years. He believes in that. He challenges us to make sure that one of the things he always says to us, that there are 7 million Tennesseans that are counting on us to get this right. And there's people in your demographic that are counting on you to get this right. And so he's very engaged in that, has been a tremendous advocate for us. And part of that is getting these new buildings. And the reason I'm bringing that up is we're creating what's called innovation centers. It's going to be the first of its kind in the country, where innovation is going to be not just something we talk about, but actually foundational in those buildings. In fact, next week we're going to do a ribbon cutting in West Tennessee, close to Memphis, in our Arlington, Tennessee office, to open up the Innovation Center to the public. And the reason that's important is we utilize technology. We like to believe that Tennessee is the tip of the spear when it comes to enabling technology to make sure folks are using that to live better lives for themselves. And it also lessens some of the staffing pressure on provider agencies in a time that it's really hard to hire people. That's we'll talk about that a little bit later in the podcast. But technology is something I want you to hear me say that we are adamant about in our state. We have an entire team, an entire division that's built around innovation and utilizing technology on job skill development, interpersonal relationships, community living, all of the things that you and I probably take for granted. These innovation centers are going to be at the forefront of that. And so what we try to do, and we talk about this all the time, we want anyone who walks through those doors to feel like that they're going to get service and supports for the space that they're in at the present time. If it's a child, then we want them to know that we're there if they need us. If it's somebody that's 65 years old that might have Alzheimer's or dementia, they need to come in there knowing that they're going to get served for whatever situation that they're in. But I think the important thing for us is they're never going to know my name. They're never going to know a lot of the folks on our team's name, but they're going to know that help was there for them. And that's all I care about. As long as we're serving and supporting people, where they find themselves in life is the most important thing to me. They don't need to know my name. They don't need to know the names of the programs. They just need to know when they see the initials DDA for Department of Disability and Aging that help is on the way and help is present. And that's the most important thing to our department.
This sounds really exciting. Can you talk a little bit more about some of the services that are going to be available? And I don't know if you have all the locations planned, but you may even want to mention those.
Yeah, I'm happy to do it. So we're going to have a location in Arlington, Tennessee, which is in Shelby County in West Tennessee. That's where our current regional office is. We're going to have an office here in Nashville, Tennessee, which is where our Middle Tennessee regional office is. And then in East Tennessee, about 30 minutes from Johnson City, Tennessee, we're going to have our East regional office is going to host in our our innovation center. They were part of seating and positioning clinic is what we called them before, but we're actually expanding that definition to innovation centers. So we're still working through what a lot of that technology is going to look like, but we've been having some really strong conversation with different vendors around eye gaze, around using artificial intelligence, around using assistive technology. What is that going to look like, and what role does that play? Of course, the challenge, as you very well know, and I think most of the folks listening to the podcast, is AI is a genie that once it comes out of the box, there's no way you can put that back in. So we're being really smart about that and what that can do and how that can empower people in our space. But I'm very excited about what's going to happen with this and the lives that are going to be changed. And I think that's the neat thing about these centers that we're building and that we're going to be doing the ribbon cuttings on, is there's folks that are not even born yet, and there's families that are not even aware of who we are that are going to be there, and they're going to want to know, is my child going to be okay here? Is my loved one going to be served and supported? And the answer is an unequivocal yes. And so I'm really excited about that, excited to get community engagement and folks involved in what that's going to look like. And I'm very anxious to see what the results are going to be, because I know lives are going to be changed for the better.
Well, I'm really excited to see what these are going to look like as well, too. And I have no doubt they're going to be fantastic. It's clear just by the way the passion that you have, again, and you know, the what's behind what you're doing and why you're doing it. I'm curious, as a physician, are there going to be some health related services at these locations?
Yeah, so that's one of the things that we've been talking to. So we have an entire clinical division here. You know, one of the things that that's been really important to me and personal to me is we don't talk about the mental health of people with IDD enough. And one of the things that has happened is we run into really strong discrimination when it comes to better supporting people with IDD who have mental health challenges. You know, historically, what has happened is a lot of folks have assumed that IDD was the mental health challenge, and they didn't separate those things from an individual having an IDD versus an individual with an IDD having a mental health challenge. And we've got to do better in that. So that's something that we're intentionally focusing on in our state, is how do we do a better job serving the mental health needs of people with IDD? You know, it has, again, I go back to what I told you a few minutes ago about us being a protected class that's still probably the most discriminated against, and not just discriminated against, actively and openly discriminated against. Mental health has been a huge part of that, where people say they're doing that because they have a disability. You can imagine the outrage, and rightly so, if I said a person was doing that because they were older, a person was doing that because they had brown hair, a person was doing that because they were shorter in stature. And nobody would accept that, and nor should they. But we actively are okay with people saying, well, they're doing that because they have Down syndrome.
There's a term for that. It's called diagnostic overshadowing.
Yes, that's a very fancy and accurate term.
We attribute the behavior or symptoms of a treatable underlying condition to the person's overall diagnosis of intellectual disability and say, oh, that's just what people with IDD do. And we should never do that.
That's right.
I completely agree with you.
Yeah. And so we have leaned into that. We've tried to work more with our state Medicaid agency on how do we better support this. We've tried to work with our Department of Mental Health and Substance Abuse Services on how do we better address this, because we talk about it all the time and people see it. You know, we have a program actually here that we just started called Jillian's Law that was implemented with the help of the state legislature, where individuals that were accused of a crime or found themselves in a courtroom can actually receive services and be referred to our department to try to receive services in a safe setting that protects not only them, but protects our community as well, because this is a challenge that's not going away. So we need to make sure that we meet it head on and just don't kick the can down the road. And so we're working on a lot of those. But to your original question, there's going to be a healthcare component to that, and mental health is going to be a part of that focus.
Excellent. So I want to come back to something you mentioned a minute ago about workforce and the workforce challenges. Is Tennessee experiencing some of those like everywhere else?
Yeah, we really are. And I want to be clear, though, that the folks that are in this service are godsends and angels from above, because we could not function as a department without the provider agencies that we have and the DSPs that show up to work every single day. I mean, the stories that I hear from the times that they have shown up through snowstorms, ice storms, flooding. I mean, you may have heard about this, but we actually had a hurricane in East Tennessee about 2 years ago. Hurricane Helene came up through Florida and ended up in East Tennessee, which is...
So I actually live in Western North Carolina and experienced a lot of that.
There you go. Yep. You know exactly what I'm talking about.
Yep.
Well, the stories that were shared with me from DSPs that stayed at the houses so the individuals that they care about and supported were not alone. it's mind-numbing to me because of the tenacity and just the belief they have in, I'm going to take care of the person that I'm responsible for. We cannot do it without them. And so we're working to address the challenges of workforce. Part of that is making sure that we're improving the pay of DSPs.
Yep.
Our legislature has been very generous. The governor has been very generous in making sure that we do that. We're still working to do better there. One of the challenges we don't want to keep doing is just playing catch up. We want to actually be in front of it. But the other thing, again, to do that we're working on is enabling technology. So we want folks to know you don't have to have somebody sitting on your couch 24 hours a day. You don't have to have a person around you all the time if you don't want to. So we've really accelerated the way that we've introduced technology into our support programs and into support plans. And a lot of folks are now thriving more than they ever have. And what's great about it is they're thriving in a space that their parents or their loved ones never thought they would be able to accomplish. Because I think sometimes we as parents have preconceived notions and our own level of fear and discrimination against our child about they're never going to do this. And yet again, they're proving us wrong at every step of the way. So really excited about what we've been able to do in that space, but we're still at a critical juncture in how do we continue to do the right support the right way without the system being in trouble, and technology is all part of that.
Yeah. Technology is advancing rapidly in many different ways, and certainly can help with the workforce challenges that we all face. And not only that, like you said, I don't want somebody sitting next to me 24/7. If that can be done from a remote setting, I would prefer that.
Right.
So it's always thinking about what do we want for ourselves? What do we want for our own lives? And how, what can we do to move people in that direction? I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So Brad, I always ask guests, what are three things, 3 tips, 3 words of wisdom, 3 top priorities, whatever you'd like to talk about that you think can really improve supports and services or healthcare or just the world for people with intellectual and developmental disabilities?
Yeah, I mean, one of the things I think that I would start out with is we always need people that are advocates that are not in our field. We need champions who are not necessarily parents or not necessarily caregivers. It's really hard to get stuff done if it sounds like we're just a broken wheel who are just a small niche in a community. That actually is a much broader conversation that's happening, because we need people caring about what happens to Tennesseans with disabilities and Americans with disabilities. Again, we still have 30 plus states that have institutions. Institutions are really a relic of the past that I know that some folks are like, that's what we should be doing and we need to do that. We need advocates who are in the state legislature that do not have family members in the disability community. We need advocates in the community who care about their fellow man and say, this is not the way that we treat people. I think one of the neatest things that I've seen that I'm really encouraged about is the number of young people that are coming up, both in the school systems in elementary and middle school and high school and into college, who understand that an integrated classroom is just part of their overall experience. So the more that we can create a conversation about integration in education, I think will change the country. I can speak for me. I can't speak for you. But when I was in school, segregated classrooms were the norm and people didn't even think about it. We didn't see students with disabilities at lunch. We didn't see students with disabilities at pep rallies. We didn't see students with disabilities in athletics. There's a new generation of students that are coming up that say, hey, this should be fully inclusive for everybody that has a disability, like my friend so-and-so. And I think that's really important. So I would, number one, encourage advocacy. Number two, housing is a massive challenge for us, that we need people to step up and creative in how we have conversations about housing, because it's directly tied to number one. We do not want to go back to institutions. And I'm very proud to say that in the state of Tennessee, we do not have institutions. But I can tell you that nationally, there's a growing wind to go back to institutions, because one of the massive challenges we face is, how do you provide affordable and adequate and appropriate housing for people with disabilities? Housing is going to be, over the next 5 years, the next 10 years, with staffing, probably the number one issue that's going to impact the ability of Americans with disabilities to continue to live independently and pursue the American dream, because that leads to vagrancy. That can lead to real challenges, including health. As you know, as a doctor, if you don't have stable housing, if you don't have stable meals, if you don't have a stable diet, creates all sorts of challenges for yourself, but also for people around you, which then can create some unnecessary and challenging strains on public health services and systems of support, which we really want to avoid. And I think the third thing is a very simple thing. And this is the way that I word it. Diversity is having a seat at the table. Inclusion is having a voice, but belonging is actually having a voice that's heard. Big difference when you actually listen to what somebody is saying. So the third thing that I think we need to do is actually invite the right people to the table, where we don't just sit there and put words into their mouth to say we know what they want. We actually have a conversation, ask them in their life for the first time, well, what do you want? And I think we'd be really shocked at the answers. And until we start doing that consistently, we're going to continue to build systems that we think are the best for people that we serve, instead of asking the people that we serve to support, what do you want or what do you need? So diversity is having a seat at the table, inclusion is having a voice, but belonging is actually having that voice heard. We need much more belonging than we've ever had in the history of our country to make sure that we're serving people the right way.
Brad, there's nothing to add to those three things. They really are something that I want everybody to hear and take to heart and advocate for these things to occur. So advocating, housing, and belonging. And I love that term. Brad, I can't thank you enough for joining me today. You shared some incredible insights that we want to share far and wide. And more importantly, though, for the incredible work that you and your team are doing in this field. Thank you so much for joining me.
You're welcome. Thank you for having me, and best of luck to you and to your listeners. Tennessee is always ready to help. If there's anything we can do to serve and support you in your state as well, we're just a phone call away. So thanks for having me.
Thanks, Brad.
You bet.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.